Assalamu alaikum, and today's topic is stroke and its types. And stroke, of course, you can say in other language, this is the cerebrovascular disease or the cerebrovascular accident (CVA). So the various names used to denote this stroke, and that's commonly even called as paralysis in the limbs or whatsoever. So various organs of the central nervous system are involved. So we're going to study the central nervous system, ischemia leading to stroke, and they afflicting various organs. And of course, there will be a generalized discussion of the general concept of the class. So this is the introduction, and this is the stroke. It's the definition that blood flow to the brain is obstructed. Blood flow is compromised. Of course, there occurs a narrowing of the blood vessels. So this is called as ischemia. I'm familiar with the word ischemia. So that is the lack of oxygen in the brain. So that is the point. So blood flow to the brain is obstructed and there is lack of oxygen in brain, which leads to tissue death, which is known as necrosis. So whatever part of the brain is necrosed, to symptoms related particularly to that area are produced in the body. So how we classify stroke? Which are the various types of the stroke? How you classify that? This is the classification. First of all, we have an ischemic stroke, and then we have an hemorrhagic stroke, right? Hemorrhage would be due to some blood loss and rupture of some artery, the vein. So ischemic stroke, this is the narrowing of the blood vessels due to the ischemia. That is the two types of the ischemic stroke resulting from thrombosis. This is a thrombotic stroke and resulting from an embolus, formation of embolus. And then I tell you later on in the next slide, embolic stroke. So hemorrhagic stroke, when the hemorrhage occurs, there is an intracerebral hemorrhage. This hemorrhage is inside the brain somewhere, and then is a very important subarachnoid hemorrhage. So this is the hemorrhage in the subarachnoid space, which contains the cerebrospinal fluid present between the arachnoid and the pia mater, meninges. So this is the various types of the classification of the stroke. And you see, this is the picture. This is a formation of the thrombosis. This is a thrombotic stroke. So you see what happens here. So this is a blood vessel, blood flowing like this. You see the laser point in red color. This is the thrombosis going there, and this is blood flowing. And this is, there is a clot, the thrombus formed over here, right? The blood vessel lumen. This is the lumen. And it's from that point onwards, there is no flow of the blood. It is stopped. Here the flow is continuous. So whenever there is a thrombus in an artery in its lumen, and the blood flow beyond that is stopped. So what happens? That area gets necrosed, no oxygen going to that area. So that leads to death of that area, the necrosis, which is the ischemic stroke or the thrombotic stroke. It's the first type of ischemic stroke, which is the thrombotic stroke. And this area has been necrosed, and whatever systems, for example, the motor system is attached to that, the symptoms will be produced. Then is the embolic stroke. So what is that? The embolic stroke. And in embolic stroke, there is an embolus formation, right? This is the embolus, right? An embolus can be an air embolus, that's a fat embolus, it's right. It's due to it obstruct the this blood vessel over here, and there is no blood supply going to the area distal to that, and that, for example, this is area of the brain in this quadrangle, and this is the compromised, and this is not getting no oxygen, gets necrosis, and the symptoms are produced to the involvement of that particular area. These are the two types of the ischemic strokes, thrombotic and embolic. And then is a cerebral hemorrhage, which is some Pleased to see this is the cerebrum, and this is the section, the coronal section, and this is blood vessels, you see, and this is bleeding of the blood vessels. This is the hemorrhage. So this is occurring after, hemorrhage. And here you see the symptoms. This is due to the this infarction or whatsoever, the stroke has its symptoms. So these are the symptoms of the stroke. You could see this is the symptoms of the strokes. First of all, of course, you see it coming to this picture. You have studied that already in one previous lecture. You must have studied. So even if not in your mind, you can devise from this simple picture. These are the cortical functional areas. These are the cortex functional areas. Frontal lobe contains the emotions. The parietal lobe contains, this is the central sulcus, and posterior to that is the sensory system, sensation narrative, and anterior to the central sulcus is the premotor area, voluntary movements, motor area. And here you can see this is the temporal lobe, and this you can the hearing area, and this is, you see, cerebellum, and this is occipital. Occipital lobe of the cerebellum is the concerned with the vision or sight, and cerebellum already, balance coordination. These are the various part and function of the brain, and symptoms would be accordingly. And there can be problems in, after a stroke, the problem in movement, communication, sight. And there would be numbness or paralysis and headache. Like in subarachnoid hemorrhage, a lot of headache going on patient. Subarachnoid hemorrhage. And paralysis, for example, various types. If this could be, unilateral, bilateral, could be quadriplegia, or the limbs, four limbs are involved, quadriplegia, and it could be ipsilateral, bilateral, one arm, upper limb would be involved, but then one lower limb would be involved. Various types of the paralysis. If the cerebrum is involved, the manifestation of the paralysis or the strokes on the contralateral side. Like if it's the right-sided lesion in the brain, the body affected would be the left side. But if the cerebellum lesion, the body gets ipsilateral signs. If the right side of the cerebellum is paralyzed, the symptoms would be in the also right side. This you already know, taught you already, that various these symptoms are encoded due to the fibers, like the brainstem you studied, like the various crossing of the fibers, various sides, and you make a concept of that. And then a few words about how you diagnose the stroke, which type of the stroke. First of all, this is a journal layout. Quick, I go through the slide. Physical examination. So examine the patient physically. What is that? Demographic data would be, what is that? It is the data which is based on the age. Of course, stroke occurs more in old age population. Then the vital signs are observed, like blood pressure, heart rate, etc., pulse. Then the history taking is very important. History taking is important. I will tell you later on. It tells the risk factors, the history of any patient at any point clinically matters, and it tells the various things. And motor assessment. Motor assessment is very, very important. It tells you about what are the power of the muscle. There are four grades, the muscle power, and then the motor assessment tells, like we have to check the motor sensory assessment, and we have to check the reflexes, right? Also there is a sensory assessment and the motor assessment. We will check the reflexes, like knee reflex, and if cerebellum is involved, there is the pendular knee jerk. I told you already, right? And various these things, many of them already discussed, and you haven't gone through many of you certain portions of the central nervous system maybe yet, so we'll do accordingly in that. If somebody studied spinal cord, so you know what are the various lesions at that level, spinal cord level, and what are the afflictions of what's the Stravinsky sign, and what's the upper motor neuron and then the lower motor neuron. So you can go back to these lectures. If you haven't done that, we'll be discussing afterward with that detail. Then the cranial assessment of the cranium. This is the diagnosis is made. Then the diagnosis, second aspect is the lab, laboratory, and radiological investigation. What is that? Blood test is done. What is that? Blood is seen the thing I tell you later. Brain imaging test, heart and blood vessel test, leg ultrasound. You know why is leg important? I tell you ECG and then the various types of the Doppler, type of the Doppler ultrasound, transcranial. So blood test, what you see, cholesterol, sugar, and blood clotting time. Brain imaging, so CT and MRI. You see the names. And for blood vessel and heart, this is the carotid ultrasonography. Carotid artery is very important, and the catheter angiography, arteriography. And this you see the picture just for knowledge. This is the ultrasound go over the vein, and this is the carotid artery, and they place it over here. You see the normal, and this is the narrowed, the stenos, the narrowed carotid artery. See, you can see obviously. And the leg ultrasound, and the deep pain in the leg and the brain leads to stroke. Just remember the knowledge of the lower limb, the soleus, the peripheral heart, right, and the deep veins, and they push the blood upwards, big clot in the blood, and then the various certain very important diseases with that. When you sit continuously like hours and hours, you can get some very dangerous diseases. You should know already. We mentioned ahead later on right now. ECG, right? Yes, various effects can be seen, and I told you already. Transcranial Doppler. You see just a pattern, just to have a look at it. This is the ECG pattern. I am just showing you to coordinate and correlate with other sciences, especially physiology. They people teach you this normal ECG over here, right? This is PQRST, and this is P is related with this activation in the P wave, activation of the atria, QRS complex with the activation of the ventricle, and the T wave is a repolarization. This is the recovery phase. Normal heart rate, and this is fast heart rate, right? Heartbeat, and this is the tachycardia. This is bradycardia, slow heart rate. That an irregular heartbeat is dangerous. Could be a flutter, then could be a ventricular fibrillation ultimately, and could be very fatal. With the various medication, just this is the LTA plays just a name. Anticoagulants are given, drugs to thin the blood, and the statins are given. Various drugs, which of course certain physicians have to give. And if some other subjects are studying this lecture, interesting to that. So, but the statins are like they lower the cholesterol and like various salts. And, statins, and this is the anticoagulant like aspirin and etc. This is the surgery can be done. The carotid endarterectomy, incision in the neck, even carotid arteries opened and fatty acids is removed. And the craniotomy, if you go back to the head and neck lecture of mine, and I've shown the picture over there, and still I showed you the picture over here again. This is carotid endarterectomy, right? This is how carotid arteries opened and fatty moved out of that. And this is craniotomy, a flap from that side of the skull is removed like this, and this is then done the procedure. Told you there, and blood clot repair burst in the blood vessel. And how to prevent? This is, I think, all the more important with the diet. It's low fat, high fiber diet. Quit smoking and alcohol intake. Controlling diabetes. Maintain healthy weight. Exercise and avoiding illicit drugs. Illicit drugs like the narcotics or something like that. So risk factors can be studied from that to prevent what you see. High fat diet is a risk factor. Low fiber is a risk factor. Smoking is a risk factor. Alcohol is a risk factor. Overweight is a risk factor. Family history is a risk factor, not mentioned. Diabetes also comes from family history, very, very deleterious. It leads to ultimately high blood pressure. High blood pressure is very important, dangerous, and risk factor. And you have to do exercise. Lack of exercise is a risk factor. And to prevent, you do a lot of exercise, walk like I can do. And this is summary of the prevention. And cover the complication. Dysphagia, which can be difficult in swallowing food. And then is a hydrocephalus. What is that? Hydrocephalus. And the increase in the pressure of the cerebrospinal fluid. And then is a DVT. This is what happens in the legs, for example. I told you soleus is there, and that there's slow blood flow in the veins. It's increased blood pressure, blood clot in leg, and that can the clot can go ascend upward into the vessels in the central nervous system and can lead to stroke. So you need anti-clotting medicine and compression stocking. This certain stocking taught onto that legs, and it prevents the DVT, the deep vein thrombosis. To prevent that, you don't have to sit continuously still in a sitting position or like that. You have to walk intermittently. I think one should walk after every 30 minutes at least. Actually, somebody sits in an aeroplane and it's advised to don't sit long. Sometimes it's a 24-hour day long stay. So it's advised that after every 20 minutes, you take a walk. So the conclusion ultimately, the stroke definition is a sudden death of brain cells due to lack of oxygen and it's caused by blockage of the blood flow, rupture of the artery to the brain, and the symptoms of the weakness, the paralysis on one side of the body, difficulty with balance, speaking, swallowing. I told you already all these things. Clot busting drugs, like I told you, TPA can be used to reverse stroke prevention by minimizing risk factors. These are the risk factors. Again, enumerated here. And so this is a discussion. And if you go to the detail, more further detail, that is done with each and every section, what happens to various ischemia of this, whatever specific arteries blocked. And here, if you have to focus what the middle cerebral artery blockage leads to, and then the anterior cerebral artery blockage leads to, and then the posterior cerebral artery leads to its blockage. So that I leave for another discussion detail if needed. Anyway, where this time it's enough for you people. Let's stop over here. And I thank you very much for being patiently listening to that lecture. And stay safe, stay home, and goodbye.